All right, good evening, everyone. Bienvenue à tous et à toutes. My name is Alex
Everyone.
Munter. I'm the CEO of the Canadian Medical Association, and I'm going to be your moderator for this federal election town hall. I'm joined by Dr. Joss Reimer, President of the CMA, and David Coletto from Abacus Research, and I'll introduce both of them more formally in a moment. I'm not in my usual hometown of Ottawa. I'm in Toronto at the moment. And I'd like to acknowledge that this is, of course, the traditional territory of the Wendat, Anishinaabe, and Haudenosaunee peoples. And I make this acknowledgement to reflect the CMA's commitment to listening, learning, and walking the path of reconciliation together. So we are potentially days, if not weeks, from the call of a federal election, and we are mobilizing at the CMA, and that's what tonight's town hall is part of. La séance va se dérouler surtout en anglais.
Now, tonight's meeting will be mainly in English, but we do have simultaneous interpretation services available. And please don't hesitate to make your questions and comments in either official language.
First of all, we're going to hear from Dr. Reimer about what we have been doing and what our plans are for the federal election. We're going to then hear from David Coletto a bit the lay of the land, what's the context, and then finally your feedback, your ideas, your questions as we finalize the strategy for the CMA in the coming weeks and months. Needless to say, it's often difficult to get healthcare into the headlines during a federal election campaign. We've just been through an election here in Ontario. It was barely in the headlines, and it was barely an issue. And obviously, the chaos generating U.S. administration will dominate the election. But we are committed to using this election to both highlight the issues related to healthcare and to really build a base to be able to make continued progress in coming years. So a few housekeeping pieces. We are recording today's session and we'll post it following the town hall. At any time, please add your questions to the Q&A, and you can upvote questions. So if you see somebody else is thinking what you're thinking and you want us to answer that question, please click upvote, and we'll try to get through as many questions as we can in the time allotted. Now, before we hear from Dr. Reimer, let's just get a sense of who's here with us tonight. So we've got a quick poll coming up on the screen. What perspective are you bringing to today's call? Quel point de vue apportez-vous dans cette séance?
What perspective are you bringing to today's call?
And there are the answers. So we have a wide variety
Voilà les réponses.
Participants, and welcome to you all from coast to coast to coast. Our next question is, what are your top two priorities for this coming federal election? Quelles sont vos deux principales priorités?
What are your two priorities for this federal election?
And there you go. better access, topping the charts, almost every single person on the call today identifying that as the most crucial priority that we're facing. And then our final quick poll question. In which of the following areas should the new government prioritize their efforts when dealing with the Trump administration? Parmi les mesures suivantes,
in which of the following areas should the new government prioritize their efforts when dealing with the Trump administration?
There you go. Lots of concern about many aspects, including the false health information that is now coming out of the government of the United States with predictable outcomes in terms of, for example, increase in infectious diseases there. So thank you for your feedback. And I'll turn it over now in Winnipeg is Dr. Joss Reimer, President of the CMA, who's been working on all of those issues, and we'll give you a quick update on where we're at. Joss.
Merci, Alex.
Merci thank you, Alex, and thank you to you for being here this evening.
A time of political uncertainty, and I feel like that's really, if anything, an understatement of what we're seeing right now. 2025 in Canada began with quite an upheaval in politics, with prorogation of Parliament and the sudden kickoff of a Liberal leadership race. And we are also bracing for significant disruption under the threat of tariffs imposed by the US, possibly as early as tomorrow. Not certain, but that's what we're seeing in the news. And that's not to mention the dismantling of scientific institutions with a total disregard for clinical knowledge, for expertise, and all of the aspects that are at the root of quality health and healthcare. We are experiencing intense polarization, intense divisiveness, and Canadians at the same time as all of this is going on are continuing to be bombarded by false information online. In fact, in our own survey that we did with Abacus data, we saw that 37% of Canadians said that they had no choice but to get their health information online because they didn't have access to primary care. And 23%, so almost a quarter of Canadians, have had a bad outcome because they followed health advice they found online. And those to me are really concerning numbers because it shows us that we have two competing, or not competing, but two different issues happening at the same time, where we have both a lack of access to care and we're being bombarded by false information online. And these have serious implications for health reform. They impact healthcare costs and political will, and they put further strain on our health system. Now, on a more positive front, we are also experiencing a heightened level of patriotism, unity, and a call for homegrown solutions like we have not had in many years in Canada. And so in the upcoming federal election, whenever that may be, we have an opportunity to advocate for meaningful changes to make our health system more resilient and to significantly improve access to care. It is also a chance to call on our political leaders to follow through on the promises that they have made to address healthcare's greatest challenges. We already have some solutions to transform Canada's healthcare system. We know that we need to reduce administrative burden because it takes valuable time away from the doctor and patient relationship, as well as other healthcare providers, and adds to burnout amongst our healthcare providers. We need to let doctors focus on what they do best by investing in team-based care so that we can augment the services that a physician can provide with a team that has shared expertise, a shared health record, shared space. That partnership really makes us better. We need to cut through interprovincial barriers to make it easier for doctors and other health professionals to work where they're most needed anywhere in the country. We need to work with First Nations, Inuit, and Métis peoples to address health disparities in Indigenous communities. We need to be investing to have more Indigenous physicians and other healthcare providers in our system. We need to prepare for climate shocks and build a climate-resilient health system. And we need to fight back against the false health information, which is putting Canadians at risk. And I think I don't need to tell you that based on the survey results we saw earlier about how important that topic really is. Political advocacy is a key part of our work, and the CMA has a strong voice in Ottawa. We are delivering solutions for urgent reform on a national level. And the good news is that we have been able to make strides before, even though it does continue to feel like an uphill battle. For example, we called for and certainly welcomed the deferral of the proposed increases to capital gains tax inclusion rates. We helped secure landmark federal health funding and worked with the governments to track on progress on the reforms, looking for there to be more accountability in those agreements. Last week, Federal Health Minister Mark Holland cited us, the CMA, in his announcement of the first signed pharmacare agreement, which was between the federal government and the government of Manitoba. And as a Manitoban, I felt particularly proud to see Manitoba sign on first. That's not in my speaking notes, but I just was excited. We launched CMA's Reconciliation Plan to advance Indigenous health and well-being following a historic apology for harms to Indigenous peoples in the health system, and now are starting on the path of our reconciliation work. We reduced the administrative burden facing physicians with several provinces creating regulatory restrictions on sick notes. So we actually saw laws being implemented in multiple provinces, as well as several others creating admin burden task forces that have been working very hard to reduce a variety of different administrative burden areas. We advocated for better connectivity between medical record systems, which resulted in the introduction of Bill C-72. Now, with prorogation of Parliament, that unfortunately did not get passed, but we are excited to see it get introduced and have been talking to government about how to bring that forward when the next Parliament starts again. We are supporting ways to make it easier for doctors to work in other provinces and territories through initiatives like the Atlantic Registry. We also know that the Medical Council of Canada will be doing a national physician registry that could be a helpful step forward in making physician mobility an easier process. And after all of this, a federal election creates a key moment for the CMA to work with all parties, all candidates, to identify solutions for healthcare. But to do that, it is essential that we understand our political landscape to effect meaningful change. Providers and patients can work together to hold our political leaders to account. So we will be using the 2025 election to develop relationships with candidates, to host regional events, to deploy an advertising campaign, to name a few examples. As we are finalizing our plans, tonight is our opportunity to hear from you. And we will be following up afterwards as well to share information on how we can continue these important discussions. It is time to ensure that politicians know that Canadians deserve and expect a health system that works. And so with that, I'd like to hand it back to Alex.
Thanks very much, Dr. Reimer. And now we will head to Ottawa, where David Coletto, CEO and founder of Abacus Data. Sorry, David, I called it Abacus Research before, but that is what you do, market research. David is also, if you like what you hear in the next few minutes, you can get more of it at the In Focus with David Coletto, new podcast that explores the kinds of things that he's going to be talking about. So thank you for joining us tonight. David, over to you.
Well, thanks, Alex. Thanks, Dr. Reimer. Good evening, everyone. Really great to be here. I'm going to jump right into my presentation. There's not much going on these days, so not much to explore. But even just in the last few hours, the world is kind of shifting under our feet, and I think that's really the perspective I want to bring today to set up where I think Canadians are coming out as we approach a likely federal election in the next few weeks or months, and just to give you a sense of what I get to do every day, I get to ask thousands of Canadians hundreds of questions every week, and with my team at Abacus, we are seeing over the last number of weeks a significant shift in the mindset of the public. And we have been proud to work with the Canadian Medical Association now for a number of years on that project that Dr. Reimer mentioned and others, sort of exploring the connection between these. But I want to start basically at the big picture and remind us all of all the things that we have all lived through over the last 5 years. And to ask ourselves, what is that doing and how is that affecting the way that Canadians are digesting, filtering, interpreting the world around them and their place in it. In 2022, the Collins Dictionary came out with their word of the year, as they do every year. And they used, and in 2022, their word of the year was permacrisis. And they defined permacrisis as this extended period of instability and insecurity. And I think we could all agree that 2023 and 2024, and now just 2 months into 2025, that we continue to be in this state of permacrisis, that at any given moment, people are wondering what's next, right? What is the next thing I'm going to have to deal with, to adapt to figure out how to just achieve the things I want, get the basics, and what does that all mean going forward? And when you think about Canada, 3 things I think are really important to understand the uniqueness here. One, we've had a rapidly growing population over the last 2.5 years. Close to 2.5 million new people have been welcomed into the country. That has put pressure on not just the health system, but a number of other key institutions and systems that have created increased anxiety. At the same time, our population's aging, which is adding its own pressures to a number of systems, including our health system. And then finally, and related to both of those, we have a housing affordability crisis that I think is in many ways at the center of so many of the challenges that we're facing as a country. And so those 3 things, plus the broader perma-crisis mentality, I think has driven what I call a prevailing mindset that I call a scarcity mindset. Now, this picture looks really scary, and it's maybe a dramatization of what most people are feeling. But the scarcity mindset basically is saying, regardless of your age, regardless of what part of the country you live in, regardless of even your socioeconomic background or your cultural background, is the things you need in your life are more expensive, they're harder to get. And if you have them, you are deeply worried you're going to lose them. And I think having access to a primary care provider, for example, is the perfect example of that someone may have one, but that physician might be retiring in a number of years. And you're just wondering, where am I going to get my next physician if I've got to join a line of millions of other Canadians who don't have one at the moment? And so what I want to explore in our time together today is how that mindset is shaping the coming choice that I think Canadians are considering as they ultimately are going to decide who's going to lead us over the next number of years, and how that has evolved over the last number of weeks as what's happening in the United States and the threats that Donald Trump is bombarding us with on a daily basis is doing to that mindset and the broader questions that people are answering. So that's really the journey that I'm going to take you on over the next few minutes. Now, all of the data I'm sharing with you today comes from surveys that my company are doing almost on a weekly basis. We're interviewing close to 2,000 Canadians at least every 2 weeks. And so I'm going to also have some data that I'm going to be able to share with you, showing you the trend over time and how things are evolving. Now, I want to start with the big picture. Pollsters like me like to ask, how are Canadians feeling? What's the overall mood of the country? And so when you ask people, do you think the country's headed in the right direction or is it off on the wrong track? 30% of Canadians today feel that the country's headed in the right direction. And when you look at that trend line, this is going back all the way to just as the pandemic was starting in spring of 2020. You can see, first of all, at the end of this chart, that's today, there's been this rapid spike. We are at a level of 30% that we have not seen in over 2 years. Dr. Reimer talked about this patriotism that's coming out of a lot of things. Alex, you mentioned it as well. That, I think, is what's driving this sense that although the fundamentals of our country aren't really improving, people's sense of Canada relative to the United States and other parts of the world is feeling more positive. But we are still lower on this measure than we were in April of 2020. More people felt then that Canada was headed in the right direction than they do today. And so we'll see whether this trend continues, and it may signal a new era. I talk about these 3 eras over the last 5 years. This may be re-entering a new era where scarcity is less the focus, perhaps something else, maybe precarity more broadly is something we're watching. But for now, what does scarcity look like? Well, I ask a question: what's keeping you up at night? And Canadians can write anything they want. And this is a word cloud in English showing you the responses, right? And so some of them are very specific, like I have insomnia, or I'm stressed, or I can't sleep, or I have anxiety. But you see other things that are common to the sense of scarcity: housing, cost of living, prices. You see Trump, big word there, tariff. That's new. That was not there in the summer when we first started asking this question. And so what this is telling us is that these questions around particularly around the economy, around my ability to afford things, my health, my wellness, my ability to access the care that I need are front and center to many people. In fact, when we then ask a slightly different question, we say, here's a long list of issues. Which three are most important to you right now? Which are the most important facing the country? And so for the longest time now, the cost of living has been number one, although it's down from the high of close to 70% a few months ago. Healthcare is tied basically with three other issues for number two at 38%, followed by housing and the economy. But Donald Trump and his administration is now up in this mix. It's up 20 points in a few weeks. And so 4 in 10 Canadians say one of the top three issues facing the country is Trump himself. And its relationship to the economy, to healthcare, to the cost of living, to the broader insecurity that people are feeling are related. Now, one of the things I'm always fascinated is how do different groups view this? And when you look at this at a national level and you look at the regional or provincial differences, interestingly, there's not that many. As much as we think we are divided as a country, you could go to small communities in Nova Scotia or New Brunswick or Northern British Columbia, and they will have very much the same set of issues that those living in Vancouver or Toronto or Montreal do, right? Healthcare access is particularly acute in Atlantic Canada and Quebec. Housing a little higher in some of the larger urban centers, but for the most part, we typically agree on what these top issues are. But one lens I think is interesting to explore is the difference between younger and older Canadians. And what this chart shows you is those issues at the top: job security, housing affordability, inequality and poverty. Those are issues in which Canadians under 44, I use that as a cutoff because right now I'm still a younger Canadian, although I'm on the verge of becoming older very soon. I know I look very young. I'm a geriatric millennial, now firmly in middle age. But those are the issues that younger Canadians are more likely to rate as top issues. Now look at the bottom of the list. These are issues in which those over 45 are more likely to rate. So you've got healthcare, not surprising. We've seen this consistently. Older Canadians, particularly those over 60, much more likely to rate that as a top issue. Donald Trump and his administration, there's a huge gap in the engagement of Canadians by age on the Trump question, but even climate change, an issue that we used to think was an issue that young people were much more engaged on, has become one in which those older cohorts are more likely to say is a top issue right now than those who are younger. And that's in part driven by this scarcity mindset. So what's the impact of this? What's the impact of worrying about being able to get the healthcare I need or pay my rent or even feed my family? Well, I think the most important thing is that it leads to zero-sum thinking. I mean, Donald Trump, I think, represents zero-sum thinking at its greatest, right? If I am losing and you're winning, I'm going to try to take that from you. But that zero-sum thinking, I think, has evaded our thinking and our behavior over the last number of years as people perceive, and this is important, perception is what I live in, the world I live in, not in so much in reality, the perception that we are fighting over fewer and fewer resources and there are more and more people needing those. And that leads to us moving down this pyramid of needs, right? Where there are now more Canadians probably than there have been in many, many years who actually fear that they will not be able to take care of their basic physiological or safety needs. And the result is those things at the higher level, at the higher up those pyramid, become less important. And so why are we not as engaged in issues around diversity or even climate or social justice is because more and more people believe that they have to worry about just their shelter or clothing or food or even personal security. And so that is a big effect on public opinion right now. Now, when I think about healthcare in particular, I wrote about this on my Substack that I think we are already, but going to be very soon into this so-called demographic double whammy, right? Where we have an aging population as well as an aging healthcare professional group that's going to lead to even more scarcity in the health system that I think is going to become, and it should be already, a central political issue. And so when we ask Canadians about their views around the health system, and I just have a few to share with you, and we ask them, how would you rate the healthcare system in your province? So on the left is the national distribution, right? A lot of people in the middle at acceptable, but keep in mind, close to 4 in 10 Canadians say they think the system in their province is poor. And if you look to the right, you can see the distribution by province or region. I apologize to those in Manitoba and Saskatchewan or Atlantic Canada for grouping you all together. I know you don't always like that. Our sample sizes aren't big enough to break you out. But the story is that in most parts of the country, more people are unhappy with the state of their health system than happy with it. But look at Atlantic Canada, close to 6 in 10 say it's poor there. Quebec higher than the rest of the country. And so this prevailing view that there are millions of Canadians who are not happy with the state of the system is the first point. But the second is a similar proportion, 43% think the system, the health system, is getting worse. It's not getting better. They don't see evidence that things are improving. And so to me, this creates an environment where health can be an issue that we discuss in the national election. For years, whenever I put a data point like I showed earlier, where healthcare is at the top of the list of issues, people come back to me and they say, well, David, that's what everybody says. Everyone says healthcare is a top issue. I'm actually somebody who believes when people tell me what is important to them, they actually mean it. That if an MP or a candidate running in a federal election, or like we had here in Ontario provincial election, went to a door, they likely heard from constituents at that door that healthcare was a top issue for them. We saw that in Ontario as well. Now, when we asked people what's the most pressing issues, and we gave them a long list, and they could choose 3, and this was a much longer list, but these were the 5 that really came to the top: wait times, staffing shortages, access to primary care physicians or family doctors, ER overcrowding, and availability of specialists. You've all heard this before, and this is not necessarily new, but and there is some regional differences in some of these, but the overall story is that it's still very much about scarcity in the system. The perception that if I need care, I may not get it. That if I have a doctor, I might lose them. If I don't have a doctor, how will I get access to that primary care team that I need? And that becomes a prevailing view. But perhaps the most interesting effect of this scarcity mindset is on the political arena, and that's what we're talking about today. The Financial Times, a journalist in the Financial Times of London, wrote an article after Trump's election in November, in which he looked at over 105 years of data and noted that in 2024, not a single national government facing an electorate saw its popular vote increase from the previous time it faced the electorate. For the first time in 105 years, not a single government saw its support go up than it saw. And if you think about what's happened in Canada over the last 12 months, we've had provincial elections in New Brunswick where a government was changed, in Manitoba where we saw a new government, in British Columbia where the government was reelected, but by barely a tiny majority, same in Saskatchewan. And only in Ontario and Nova Scotia did we actually see 2 incumbent governments buck the trend, both in terms of the Tim Houston government and just last week, Doug Ford in Ontario. And I think those 2 elections that bucked the trend are the exceptions to the rule, in part because those 2 political leaders, I believe, understood the scarcity mindset and built a brand around serving people, particularly around affordability issues in both those provinces. But when we think about the federal political scene, I mean, what became very clear over the last 2 years is that Justin Trudeau's popularity and the popularity of his own government has suffered greatly. Today, when we ask Canadians whether they believe that the Liberal government deserves to be reelected, only 1 in 5 Canadians believe that to be true. Now, that's up almost 8 points in 3 weeks. When Chrystia Freeland resigned as finance minister and deputy prime minister, and then a few weeks later when the prime minister announced his resignation, this number bottomed out. Over time, it's risen, and that's part of the story that we're seeing in polls, on all polls, basically, not just ours, is sort of this revival of Liberal fortunes, and I'll speak about that in a minute. But beyond how people feel about the prime minister, and he's now increasingly in the rearview mirror, and so people are imagining a world without him, and it will only be a few more days with Mr. Trudeau as our prime minister. But it goes beyond that in terms of how people feel about the issues. And so when we ask people who say these issues are their top issues, and we then follow up and we say, well, which party do you think is best able to handle it? On the cost of living, the Conservatives are almost 20 points ahead of the Liberals today. This is a survey we completed last week. On housing, they're ahead with the Liberals in third. On healthcare, there's actually no party that has a significant advantage on this. An interesting point about how do you create an environment where perhaps the parties need to create some difference here. On the economy, the Conservatives are well ahead. And on climate change, one of the few issues the Liberals have an advantage on over the other two parties, still, even though climate as an issue is falling down the list. But we've asked, there's three more, that are interesting. The first is on Trump. Among the 4 in 10 Canadians who believe that Donald Trump is one of the top issues facing the country, the Liberals have an 11-point advantage on this issue. And this is a preview of perhaps where we're going to go in my conversation. But it tells us that depending on what the frame of mind is, that the Liberals actually have an opportunity here. If it's about housing, if it's about the cost of living, if it's about the economy, they're trailing the Conservatives. But for those who care about Trump, they are clearly seen as the better party able to deal with it. And you can see the challenge the New Democrats face at only 8% on that issue. On job security and unemployment, a big issue for young Canadians, the Conservatives are ahead. And now in crime, it's not even a contest. So these questions give us some insight into what might happen depending on what this election is fundamentally about. And so when we ask Canadians, how would you vote in an election? Our most recent survey has the Conservatives ahead by 12. Our polling is a little more bullish than some of the others. You may have seen other polls that show the Liberals with a statistical tie with the Conservatives. Some still have the Conservatives slightly ahead, but the trend is very clear. You can see that for over 2 years, we've had a large Conservative lead nationally, but that over the last literally 3 weeks, the Liberals have gained substantially and the NDP have really fallen back. Now, part of that underneath the national numbers are two things. One is what I think is one of the most interesting and probably biggest stories of Canadian politics right now is the differences across age. That if I'd come to you a few years ago and said, younger Canadians, particularly those under 30, are less likely to support the Liberal Party than those over 60, you should have said to me, well, that's crazy, David. I don't understand that politics as we knew it was almost the reverse. That in fact, in 2015, Justin Trudeau won in large part because you saw this so-called youthquake. Young people came out in record numbers and they voted Liberal. And I think they helped propel the Liberals and Justin Trudeau to their majority in that year. But today, we've actually seen the Liberals gain the most among baby boomers. And that is a really interesting cohort to think about politically because they're the most engaged on the Trump question. They're the most likely to say they're going to boycott the United States. They're going to boycott American products, American companies. And they are the most who most likely to feel betrayed by what's going on between Canada and the United States. And so they're becoming this really interesting political story. But still, among that younger cohort, something is happening that I think is particularly interesting. We see not a large gender gap, but women are less likely to be supporting the Conservatives than men are. Now, when we look at this on a regional basis, we see the Conservatives ahead everywhere, pretty much except Quebec. Atlantic Canada has become a little bit tighter. But if you look at that second table below, this shows you how people will vote depending on what issue they say is most important to them. So for those who say affordability, cost of living is more important, you can see the Conservatives are ahead by almost 20. That's why the Conservatives keep talking about the carbon tax. That's why they want that issue to be focused on, because they are stronger on that issue. But if the election is more about healthcare, if it is about Trump, it's a far more competitive election, as you can see, with the Liberals slightly ahead of the Conservatives among people who care about those two issues more than others. Now, to wrap up, I guess I have to address sort of the Trump effect. And what I think has happened, and probably the simplest way that I can describe the way that Trump, not his election, because that was a while ago now, his inauguration and what's happened since, basically over the last month and a bit, which is crazy to think it's only been that long, is he has reset, I think, some of the thinking of the public. And so we asked a question on our survey recently where we said, if there's a federal election later this year, which of the two is going to be more likely to decide your vote? Is it going to be about the party best able to deliver a change in direction and policy? 54% of Canadians believe that is what's driving their vote. Or is it going to be about the party best able to handle the impact of Donald Trump's decisions? And so you can see the country's basically split. And only a few weeks ago, I think the overwhelming majority of people, regardless of what I put to the right of this screen, would have said, this election is about change. I want change, and I want it now. I want Trudeau out. I want anything but Trudeau, and I'm willing to accept any alternative, frankly. Now that's shifted. And so what Trump has done is changed what pollsters and political analysts call the ballot question. And the kind of person we're looking for to hire to take the country forward going for. So when I think about public opinion today and where we're likely going, I think on one side of the scale, you've got affordability and the cost of living and the sense of scarcity that that's creating. You've got still a desire for change. The Liberals have been in power for 10 years, which is typically the natural life of a government. And you have Pierre Poilievre, who, despite some of the challenges he's faced recently in terms of navigating the Trump challenge that he has, still is relatively popular for an opposition leader and relatively well known compared to those that have come before him. Those are all things that would benefit a Conservative victory. On the other hand, you've got Justin Trudeau in the rearview mirror, farther and farther away, and as of Sunday will no longer be Liberal leader. You've got Donald Trump, and you've got this renewed sense of patriotism that is tipping the scale back to the point now where if we were doing this webinar 2 months ago, Alex and Dr. Reimer, I would have said, without any doubt, I believed a Conservative would win the next election. Today, I'm far less certain of that. I still think the Conservatives have the advantage, but the situation has changed so much in such a short period of time, and it's showing up in the data in terms of how people are thinking about those choices. Now, I just want to end with Premier Ford. As Alex said, we just completed a provincial election in Ontario in which the Trump question was central to that. And I think there's a lesson here about what that means for a possible federal election. Despite efforts by the opposition parties to make healthcare central to the conversation in Ontario, and they were effective in raising the salience of that issue. We saw healthcare rise as an issue that more voters said was going to be instructive to how they voted, but it came nowhere near to concerns around Trump and the threat of tariffs or affordability. And so I think the Ford government and Doug Ford himself, even his response today, I don't know if you saw, he announced that he's going to turn off the power and shut down basically Michigan. He threatened if Donald Trump brings in the tariffs tomorrow. I think demonstrates to us what the difficulty of getting any issue beyond this one into this election. And if I think back to what makes particularly this election likely to unique, is in the same way that the 1988, for those of you who either lived through that or have read about it, was about the free trade debate. I think this coming election is going to be about who do we feel most confident can take our country forward and navigate this really challenging time. And so was my prediction, I still think the Conservatives have an advantage. I still think that it is likely we will get a Conservative government out of this. But I think things are far more volatile, and Canadians, I think, are far more open-minded to being persuaded about their choices than they have been for over 2 years. And so that leads me to the conclusion that if tomorrow the tariffs do in fact come into place, that's going to further antagonize the public and create a space for a different conversation, I think, than the one that we would have expected to have just a few months ago. And so I'll end there. I will just do a quick plug. I've got a Substack. If you're interested in this kind of stuff and you want to follow along, you can subscribe to that there. And you can reach out to me as well by email if you have any questions. So I'm going to stop there, Alex, and I'll turn things back to you. Thanks.
David, and just to reassure you, we're all on the verge of getting older, so don't feel too low. So I have a question here, each for you and Dr. Reimer, and then we'll go that I had before, and then we'll go to the Q&A that are being submitted. And a reminder, please put your questions in the Q&A section of the chat. And if you see a question that you think is particularly important, upvote it. David, I was struck by the difference you highlighted between younger and older voters as it relates to Trump. And I'm inferring from the data and the way you've asked the questions, that what people are focusing on is Trump. It's hard to avoid, as opposed to Trumpism, which is all of the kind of set of beliefs, whether that's about equity, whether that's anti-vaccine, all of a package, which in fact, younger voters actually are probably less likely to be aligned with overall. So I'm just wondering, when you ask the questions, is just the chaos that the president is generating on a minute-by-minute basis what's the right words? So hard to avoid that it really is about Trump, as opposed to the set of beliefs and values that his movement is pushing.
I think two quick points on that. I think the first is, and this comes, we really highlighted this in the research we did on misinformation in the health information ecosystem. Younger Canadians are generally following the news less, right? They're not glued to their, like, I think of my 70-year-old parents who literally turn on CBC News Network at 6 a.m. and they don't turn it off all day, and so they are bombarded with news of Trump, and they get anxious about it because they see it and they're constantly consuming it. So I think one reason why younger Canadians are just less likely to put that and be as flummoxed and anxious about it is because they're just not as exposed to it as much as older ones. On the question of Trumpism, though, I'm going to challenge you in that I think there's a big difference between being a young male and a young female right now. That there are a lot of young men in this country, as we saw in Germany, who voted last week, and you saw the rise of the far right. That was propelled by young men in that country. We saw it in the UK and in Italy, and Trump himself, that there's something happening among young men that is different than young women. Young women I would agree with you, reject Trump full out, don't embrace some of those ideas, but not all young men do. There is and to give you a sense of what's going on, the demographic that is most likely to be a fan of Pierre Poilievre in Canada right now is a male under the age of 30. So there's something happening there, Alex, that leaves them, young men, the most likely to say they would consider joining the US as the 51st state, whereas almost every other Canadian would reject that idea. There's something happening that's beyond that there.
Interesting, and not to debate it with you, but from a health perspective, Trumpism and the alliance between Trump and misinformation promoting tech platforms is a very significant threat to health and the healthcare system.
Absolutely.
Dr. Reimer, David's given us all the reasons why people aren't paying attention to health. But what can the CMA do as we are dealing with Trump and Trumpism in Canada? What can you just sketch out what we're working on?
Yeah, and I think so. I've had conversations with Minister Holland about this, and we even had a meeting about the tariffs specifically, because this is front of mind to everyone right now. But when we talk about the health system, income is the number one determinant of health. And so when we see threats to the economy, when we see threats to people's personal income, when we see that cost of living is the number one concern for Canadians, all of those have major health implications. And so when tariffs come in, we can anticipate that we're going to see a worsening of health for Canadians and an increased burden of need on the health system. So we're going to have increased demand with potentially decreased services. So this is something that the CMA is in a really important position where we do have the ear of the federal government and need to be flagging that even if attention is going to the economy, the attention is going to what Trump is doing, we need in Canada a strong healthcare system to help mitigate the impacts. It's not going to erase them, but it could help insulate us a little bit against some of those health impacts because they will be very real. But also just building on some of the successes that we've had. I mean, I already went through some of them, but thinking about, the bilateral agreements that we saw from the federal government and major increases in funding that went to healthcare, with accountability built in, not as much as we wanted to see, but still built in for the first time in many years. We've had a number of wins. We know that things like pharmacare are going to help reduce the cost of living on a day-to-day basis for Canadians. So that's also an important area where we can be flagging that this is another important thing for us to be doing. But even on the tariff front, like I said, I had a meeting with Minister Holland, and we talked about the impacts that we can expect to see on health, but also the impacts on the healthcare system if suddenly everything costs 25% more, and what that might do to access and what that might do to what Canadians are already facing as far as challenges getting the care that they need. So I think the CMA is in a really critical position where we really can maintain a focus on this. But even more than that, we need Canadians to be thinking about this and telling the people who are asking for their votes what matters. And if their health is a challenge, if they don't have a family doctor, if they can't get into the emergency room, if they can't get a specialist visit or a diagnostic test, we need to be telling them when they come to the door and they're listening and wanting to hear your input, then that's what we want to hear from Canadians, because their voices are going to matter. And then, of course, voting.
So the first question from the audience, Dr. Reimer, it really builds on what you've just said. How is the CMA going to ensure the longevity and security in service provision through governmental change? So how do we ensure the continuity in terms of health services government change, especially considering volatile governments like those in Alberta and the need to service vulnerable populations, i.e. gender diverse and racialized individuals?
Yeah, the CMA is committed to advocating with whoever is in power. That is what we do, and we work with, and even currently, we work with all political parties to make sure that they've heard about the impacts of different policy decisions. So I'll speak to what I've been doing. I've had meetings, with every political party to talk to the individuals. I've had hundreds of meetings with different members of parliament, different senators, to make sure that this is staying front of mind for all of them. And there are different areas where we focus on depending on which group we're talking to, because there's certainly different political interests that different parties will grab more onto, but all of them still want better health for Canadians. That is a goal of every political party. And so we want to work with whoever's in power. And we also work with the provinces. We work with the provincial and territorial medical associations to align our message to make sure we have one voice on behalf of the profession across the country, so that both at the provincial territorial level and at the federal level, we're pushing in the same direction. We also have made public statements against some of the concerning things we've seen in different provinces when they've made decisions. So the Alberta example of the restrictions on trans care, we came out very strongly with every single provincial and territorial medical association saying we did not want to see politicians in the clinic room with the physician and the patient, that these types of complex decisions are sacred and they need to remain between the health provider, the patient, their family. And so that type of work needs to continue, where we do flag if there's concerning things, that we're there to say, this is in the best interest of Canadians' health outcomes. So we will continue to work at all levels of government with all political parties.
Joss, I'm not sure if this next one is a rhetorical question or an actual question, but I'll read it to you. Could the answer be that government is more interested in the health of the budget, in health of the budget for healthcare than in the health of taxpayers?
Yeah, I mean, so in the government's defense, they do have to pay attention to the budget. That is part of what it takes to govern a country. And healthcare takes up a lot of the budget, especially at the provincial level. It's usually half of a provincial budget. And what we need to flag is that investing in prevention and in primary care and in mental health are good budget decisions. And so the ideas that we're bringing to government are not just spend more money, they're spend money in strategic ways that are actually going to benefit Canadians and make the system better. If someone doesn't have a family doctor, they are more likely to have their health needs unmet. They're more likely to go on to have more complex needs and then need emergency care or a hospital admission, which is far more expensive. Or if there's not a long-term care facility or home care available to somebody and they stay in the hospital, they're spending thousands of dollars per day on that person when that's not necessarily what they need. So, is government interested in budgets? 100%. Yes, they are and will always be interested in the money, but we want to bring them solutions that are more efficient. We want to make the system better, not just ask them to invest in more.
And I think the other part of that is, I think we have to be lucid about the fact that we're now, as a country, sandwiched between two hostile nations that have significant military power. Governments are the federal government's talking about increasing military spending. The pressure for resources will be even more difficult for us in healthcare than it has been. And so we really are going to need your help. We're going to need to really mobilize and to be able to make the kinds of arguments that Joss has made, and even to make the argument, we spend $380 billion in healthcare in Canada a year. A lot of that we spend in the United States. So there's also in terms of technology and medical supplies, and there's an opportunity there as well. So, but I think the takeaway is we are gonna need to mobilize, and we're gonna need the help of everyone on this call to do that. The next question is about what people think, and so I think that's a David question. Do people really believe that eliminating the federal carbon tax and subsidy offsets will make life perceptibly more affordable? Is that an accurate understanding?
I would say for about half the country, it is, and then a quarter say no, and a quarter say I don't know. I think that over time, the argument on the carbon tax has been largely lost in terms of both its effectiveness in people's minds at ultimately solving the problem it's designed to help solve, not solve on its own, but also this perception of the cost that people are paying. And so, yeah, I do think we've seen it over time. It's become one of those. It's become a very effective proxy for the broader cost of living concerns that people have. And I think the Conservatives have just been very good at, along with a number of lobby groups that have been in favor of getting rid of it, have just been effective at really shaping a large enough segment of the population's belief on it, to the point now where even the Liberal leadership candidates are saying they're gonna get rid of at least the consumer price.
All right. And one more, we have time for one more question before we go to wrap up. What broader narratives about the future of healthcare do you think will emerge from the election? And how might these stories influence public perception and the decisions the next government will make? Who wants to take that one?
It's kind of in between us. I don't know.
Why don't you start, Joss?
Can you read it one more time? Sorry.
What do you think out of the election? What narratives do you think will emerge about the future of healthcare? Not about healthcare, but about the future of healthcare. And how might these stories influence public perception and therefore the decisions that the next government will make? Goes a bit to your scarcity mindset stuff, I think, David.
Yeah. Yeah. And I think access to care is going to remain at the top because that's what we regularly hear from Canadians. I think that's what David's data was showing. And what we need at the CMA to do is take that and talk about the solutions to that, and not just focus on, okay, yeah, wait times are bad, but what do we do about that? And that's where I really want to bring the discussion. I think we've had knowledge that the system is in crisis for many years, and now is the time where we need to move towards, well, what do we do? So we've now got the politicians agreeing the system is not in a good place, but where to go next is where the CMA has opportunity and where voters have an opportunity, where different non-governmental organizations have an opportunity to make their voices heard about what needs to be done. I know I was glancing through some of the questions, and there were some really good observations about the importance of looking at the social determinants of health, of looking at prevention and chronic disease. And these are all really good investments and ways to make the system better in the long term, and things that, while maybe they don't grab the political attention in the short term, those are the types of things we need our decision makers to be hearing about, because we want to think in more than just a 4-year cycle. But we are where we are, and the election is coming, and I think access is absolutely going to be the top healthcare issue, even though it may not be the top election issue.
Well, sorry, David, quick 30 seconds.
Yeah, I just think there's 3 quick areas that I think we're gonna touch. If this next election is not about healthcare, and I think because of Trump, it will unlikely be. I think the next one has to be, because of our aging population. And one of the things the scarcity mindset has done is it's created resistance to immigration. And so we're not going to be able to, the social license will not be there to grow our population as fast as it has. And so that is going to put additional pressure on governments to try to figure out how to deliver healthcare to an aging population. I think one area, though, that is not talked enough about, but I think that the consumer wants it to be, is around broader questions around wellness. And I think the federal government has a direct role in that, on the regulation of certain pharmaceuticals, on food, on all those kinds of things. And I do suspect that could be one of the narratives that comes out as well, that is in firmly the federal government's jurisdiction.
All right, I'm gonna cut you off there, David. Thank you as always. Lots of valuable insights. We really appreciate working with you. And a reminder, David's a podcast and a Substack for more of the same. Well, not the same, be better next time. Joss, there's one kind of final question, which actually was the question I was also going to ask you in terms of the wrap up of where we go from here. And that was, which are the best ways to get politicians to pay attention to healthcare issues? In the provincial election here in Ontario, Conservative candidates refused to attend community forums or even engage in discussions on radio or TV. So maybe as we wrap up, if you could just talk to us a little bit about the next steps that we're planning at the CMA.
Sure. And that's the whole question of what we're trying to discuss today, is how do we get these issues to be on the political agenda and part of a federal election, but there's also going to be ongoing provincial territorial elections throughout as well. So there's always an election happening somewhere in Canada. So today's town hall has given us an opportunity to take a deeper dive into the uncertain political climate. And it was really helpful to me to hear from David about how public opinion has shifted in Canada recently, and what makes this federal election so unique. So there are a number of things that Canadians can do, and that includes things like responding if someone's knocking at your door, or setting up community events, voting, absolutely, putting things on social media, making sure the politicians have heard what's important to you. But what we're also doing, and I can see it's on the screen now, is we'll be hosting a health summit later this month. And the goal there is to bring together hundreds of physicians, medical learners, health partners, people with lived experience. It will be both in person in Ottawa as well as virtual. And our focus at that summit will be on the politics of change and how to ensure that the health system issues, like the impact of the Trump administration on Canada's health system, like artificial intelligence. I think there was a question about that as well. That's an important topic that we need to include as we talk about where healthcare is going, because we know that that's going to play a role in healthcare. To talk about reconciliation and how that fits into our work, as well as access to care and how to keep all of these topics top of mind for decision makers. So I do want to put out a call to everyone that if you are interested in getting involved in our advocacy, we'd love to see you there. We will specifically also be offering an accredited course in mobilizing change in healthcare. So teaching people how to be advocates, what you can do at multiple levels. So that will be happening at the Health Summit as well, and we would welcome participation there. But I think it's more important than ever that our voices are heard. So I was inspired. I went to a conference that was put on by medical students, and one of the things they said is that they want to set up a campaign to try to get all of the med students in their school to vote. And I thought that was a fantastic idea to really mobilize their group, their peers, the people they can influence in their spheres to make sure that the politicians are hearing from them about what matters to them. And that was something that I took away as very inspirational, and wanted to take that to other people to say, take it to where you have spheres of influence and move things forward, but join us as well, and we can help bring these things forward. The politicians know we're having this health summit. We've shared it with them. They're very aware. And so together we can ensure that healthcare is an election priority, and health is a priority as well. And I really hope to see you there. I will be there. Alex, I think will be there. I assume we'll be there. I haven't actually asked him, but I assume. And so really looking forward to that opportunity to meet people in person and again online to talk about how we can do this together.
Thank you. And this year's Health Summit will likely be during the election campaign. So it will be an important platform for CMA and for those who care about our public universal healthcare system and how we make it stronger and better. So thank you to all of you. Thank you again, David and Joss, and thank you to all of you for participating. Before we go, we've got another short poll, a couple of questions. Your feedback is valuable to us and helps shape how we organize these sessions in future. So please take a moment to answer these two questions, and hopefully we'll see you in Ottawa in person or online March 27th and 28th. Have a good evening, everyone, or a good afternoon in Western Canada.